Lifepro. My name is Amber Kivett, and I am your head of health and wellness and leader with Lifepro. Today is a special day in that we are leading up to Father's Day. And so I wanted to briefly go through and talk about some common injuries that we see in men. Doesn't really, no discrimination on age by any means. But today is all about celebrating men and Father's Day and what can we do to help prevent injuries in men. What are some common injuries or challenges that we can expect to see in individuals who are active or maybe too active? And what are some of the different products that Lifepro can offer you in order to help in overcoming pain and allowing for optimal recovery? Today, specifically, I'm going to be really focusing on Achilles tendons and the bottom of the foot. You're going to see behind me here, I've got the Horizon Balance Trainer. I have the Turbo whole body vibration platform. It was my first unit that I bought with Lifepro over 5 years ago. And so I'm wanting to share with you some of our cost-effective resources and tools that you can buy to have at home. And those of you who are needing a Father's Day gift, for that special man in your family. I'm going to go over some other favorite products that I have that I like to use for injuries commonly seen in male athletes or growing, aging men who come in to see us. We here at Kevin Kinetic Solutions are known for instant pain relief, whether that is mental, physical, emotional, or spiritual. We have a 90% success rate in healing pain or reducing pain in 1 to 3 sessions. The 10% of the clients that we see that we cannot fix are typically surgical recovery candidates. And so we at least mentally prepare them going into surgery and facilitate the recovery afterwards so that they can heal really, really fast. So we see a lot of these kind of injuries that I'm going to talk about in men of all ages. But today specifically, I'm wanting to talk about aging men between the ages of 18 and 50. However, if you are an aging male over the age of 50, you can still use a lot of these products for a lot of recovery for other ailments that might happen throughout the body. So if you have any questions on some of the things that I'm sharing with you or have any feedback of what you might be using at home or one of your favorite products that you use, whether it's for yourself or for the guys in your life, please feel free to share in the comment box and I can give you some guidance or some leadership on how you might use those products in multiple different ways or specific needs that you might have from the convenience of home. Now, I pulled up some statistics because, like I said, we see a lot of foot, a lot of ankle injuries. The Achilles tendon is like one of the largest tendons in the human body. Any kind of a tendon tissue is full of parallel fibrous structures, if you will, that have very limited blood supply. And so it is typical that, especially in aging men because of hormonal changes, that we tend to see ruptures in those tendinous areas more often than we see in females. And it has nothing to do with aging necessarily. It has everything to do with hormone levels. So when we're looking at how many individuals, I'm referring specifically to Achilles tendon ruptures right now, but when we're looking at the prevalence of Achilles tendon ruptures in men, whether they are athletic men or whether they are just everyday individuals, living the life in corporate America or just trying to live one day at a time, we see in the nation, in the United States, these statistics are United States based, and it's a wide range because of all the numbers that don't get reported. But we see between 6,000 and 18,000 Achilles tendon ruptures annually. And when we are looking at those kinds of injuries, the reason why this episode specifically is so interesting and important to many of you, it takes almost 1 year to actually recover from an Achilles tendon injury and or rupture. And the reason, again, being because of that is because of the limited blood supply and the amount of energy that the Achilles tendon is created to generate in our everyday movements of life. So if we're looking at the anatomy of the Achilles tendon, I have my my picture up here, my app that all of you enjoy looking at, I think, from time to time. I'm going to show you on a male skeleton because I have the opportunity to choose a female model or a male model. So this is going to be specifically on a male model. When it comes to part of the Achilles tendon, this is just one, this isn't even the Achilles tendon in itself. This is just part of it. So when we are looking at the lower limb, you're going to see, again, anything that is white is going to be very hard to heal because of limited blood supply. Those are collagenous. We've got 28 different types of collagen in the human body, and those are collagenous junctions, so they take quite a bit longer to maturate. But anything that is white has very limited blood supply, and anything that is red is blood rich. And so we like to be able to mobilize and stretch, massage, and vibrate the areas that are red, because that's what takes the tension off of the white. Any kind of a tendon, its job is to transfer energy from one point of the body to another point of the body. And so you're going to find that all tendons have their fibers are going to run parallel with each other. And so we're actually finding in youth sports that the majority of youth sports that we're seeing are tendon related injuries, so tendonitis, if you will. And it doesn't matter where at in the body it lies, but because the energy is transferring through those parallel fibers, most athletes or individuals can really try and become strong in their muscles, but the muscle is attached to the bone by a tendon. And so if we can't transfer that energy with the force of the contraction through the tendinous junction, then it pulls away from the bone after it becomes exhausted with overuse and overtraining for a long period of time, or in a significant power force being generated through it. So that's just one layer. When I go to add the gastrocnemius muscle, those are I call those your rocket boosters. Those are the muscles that are really explosive and powerful. They're meant to transfer explosive energy, whereas the soleus is more elongated endurance type activity energy. But when we look at the gastrocnemius, those look like those little teardrops side by side. And then you see at the top there where the white attaches, and it actually attaches to the base of the foot. And then when we turn the foot up, it actually continues through to the bottom of the foot. So super powerful piece of tissue. And it is number one injury that we see as far as tendinous related injuries in men. And the prevalence is quite high, especially in aging men over the age of 18 on up to, actually, I think that I have the statistic here on the average age, because I looked this up before I joined all of you today. The average age for those who are at risk of a tendon rupture for the Achilles is active men who are between the ages of 20 to 39. 20 to 39. And a lot of it, again, has to do with testosterone levels changing, human growth hormone levels changing, and estrogen levels being very, very low in men. And biological women, biological females, our estrogen levels are typically much higher, and that's what they think happens to guard us or provide us a little extra security when it comes to Achilles tendon ruptures in women. We tend to see more of the ACL tears and meniscus tears in women because of our hip angles for delivering babies as men. And so men naturally have higher testosterone levels, lower estrogen levels. And so that decline of hormones without change in the estrogen, that trilogy between progesterone, estrogen, and testosterone, and then you throw in the human growth hormone, rapidly starts to decline into the late 20s and 30s. And that's where you're seeing the difference in healing times, specifically in tissues that do not have blood flow or have a very limited amount of blood flow. And because tendons are connective tissue bound, transferring energy, they transfer a lot of force. If you are in your mid 30s, but you're pretending to be like you're in your mid 20s, your body just cannot activate the same way as when you were younger because of how our hormones fluctuate. If you're able to hack into that and do bioidentical hormones, that is totally up to you. But nonetheless, you're still at risk. Where we see tendon ruptures, specifically in the Achilles, is with running, jumping, and walking. And it happens because of the amount of force that is transferred through the bottom of the foot. Our body absorbs energy through the bottom of the foot, and then it transfers through the plantar fascia, which then transitions into the Achilles tendon, and that transfers up to 1,500 pounds of force. 1,500 pounds of force. The bottom of your foot is meant to be a springboard, like a diving board. So it's meant to spring together and expand out. And then when it's doing that, it's absorbing energy from the ground. The energy from the ground that is introduced through the bottom of our foot then transfers up through that tendinous transfer on the back of the foot into the Achilles and through the calf complex. If you at home are suffering of restless leg syndrome, or you feel like it almost feels like your calf and your lower legs are always cramping, or you're feeling constant aches and pains, or Charlie horses in your calves, it's because there's little adhesions and little minor amounts of scar tissue developing inside of those tissue fibers. And when we don't break those apart and we don't modulate those, I should say, if we don't intervene with how much of that is being generated because of our body going all the time, then that's what ultimately breaks down how our body is able to transfer energy, and that's where the injuries occur. So again, 1,100 to 1,500 pounds of force transferred through the bottom of the foot, up through the Achilles tendon and into the low back. So if your calves are not absorbing energy, then your low back actually hurts more. So that's another little area to remember. But again, because you have limited blood flow to those tissue fibers, you're more than likely to see areas breaking down there than in other areas of the body because it's closest to the ground. So let me break this down a little bit. So when we're looking at those tissues, I broke this down to the lower level of the lower leg. So this is only like the fourth level of tissue. And then when we add layer by layer, you're going to see the white is going to start to really show up even more, and the red is getting a little bit more noticeable. But then when we start to add, this is what we call the soleus. And again, when we're looking at anything white is tendon or ligamentous. And so there's very, very limited blood flow there. And so wherever there's red is where we want to be able to make the change in the tissue. So when we change those areas in the tissue, then it takes the tension. It's not tugging or pulling in those areas that are white. And so that's where all the little tips and tricks that Lifepro has to offer you will help you in your recovery. When it comes to risk factors, some important things to remember: if you have any kind of autoimmune disease, you've got thyroid disease, you are diabetic, if you have limited blood flow to the extremities, or you are suffering of an acute illness, our body has a hard time with catching up with recovery. And again, any of those other conditions, the autoimmune, diabetes, you're going to have some challenges with blood flow and circulation and healing. You are going to be more risk at any kind of a rupture of that type. The other thing that can happen, though, is if you are training too fast for a given event, or if you are somebody in your mid to late 30s and you're still training in the weight room doing powerlifting, and you're going out and you're jogging, and then you're going out and playing basketball. When you add all of those activities together without doing some kind of tissue management, soft tissue work, or doing some kind of biohacking and to stimulate the regeneration of collagen fibers so that those fibers can regenerate and repair, you're asking for more problems. So typically, when you have somebody who has Achilles tendonitis or plantar fasciitis, even, and plantar fasciitis is that pain that you feel on the bottom of your foot when you first roll out of bed in the morning. You're like, oh my gosh, it almost feels like you're walking on rocks underneath of your heel or on the bottom of your foot. That ultimately leads to Achilles tendonitis and cramping in the calf. So it all has to start from the bottom of the foot, and just working on one area of the foot will help. But if you can follow some kind of a recovery program or a I kind of call it preconditioning, prehabilitation program, that will help in minimizing your risk for an Achilles tendon rupture. Typically, what an Achilles tendon rupture feels like when you're experiencing that is if you happen to be, you can just be walking along or picking up a slight pace in your jog. It feels, in a sense, like somebody has taken a baseball bat and whacked you in the base of your ankle. You just feel the snap and pop, and then you can no longer actually pick your foot up and move. So it is a very, very uncomfortable, painful condition. And if you have a tendon tear or rupture, you can have a partial rupture. Sometimes those will heal on their own, but they take quite a bit longer to heal because of the amount of blood flow. And if you have a full rupture, those have to be surgically repaired. And because of the weight and the energy that is transferred through the bottom of the foot, you're looking at about a year's time of recovery with rehab and surgery and acclimating back to life. So let's try and go over some things to prevent that, because nobody likes having their life restricted for a year out. So some things that you can do to reduce your risk of injury to the bottom of the foot up into the knee is you want to make sure that before you exercise, whether it's on our bikes, our treadmills, or any kind of our workouts on the platforms, if it's doing some exercise outside, maybe going for a jog, playing with kids, right? Just getting up and going to playing with your kids. We want to make sure that we are doing something to get blood flow generating into the extremities and we're getting that circulation going, but that we are also doing some kind of a warm up that kind of relates to the kind of movement that we're going to be doing. Whether it's a little bit of warm up for like light jogging to get blood flow going, or you're getting on the vibration platform to getting blood flow going. And then you're doing some stretches while you're on the platform, which I'm going to cover with you today. Or maybe it is just going for a little bit of faster pace walk or doing some stretching. So there's a different variety of things that you can do in order to warm up. Red light therapy is also another option. You can use the BioHeal red light therapy device, and just doing some red light therapy before your workout, or getting into the infrared sauna that we have back there in the corner. Those are just some easy ways without having to generate any kind of force. Those are some easy ways that you can use some products for biohacking, as I like to say, in order to prevent injury. And so there we go. So there's your red light therapy. This is our really big panel. This is the biggest panel that we offer right now. It's the BioHeal. And so you're going to see this has infrared and red light therapy. And the control panel is here on the outside. I'm not going to go through all this right now because I want you to be able to really focus in on the exercises that I'm going to share with you, because I know that's where the value is in you today. But if you need a great Father's Day gift or something for somebody for graduation or a birthday, the BioHeal red light therapy panel is a great idea in that you can do it. What's nice about this is you actually don't have to be focused in one specific area. I'm actually setting that on the platform just to make it more visual. And you can actually just stand and allow the red light therapy panel to radiate that energy into your tissues. And we're using natural wavelength energy in order to drive the energy into our fibers, which then stimulates the regeneration of stem cells and collagen that can then maturate into the tissues that we are needing to repair. So it's a very, very deep form of heat. The red light specifically is more superficial. So if you have psoriasis, or if you have a skin reaction, or you're just sore and we're just trying to take care of those superficial muscle layers, just using the red light therapy panel makes a difference. But you can also transition it into infrared light. So you can get infrared light and red light. You can't see infrared light to the naked eye. So even though you can't see it, it is on along with the red light. But you can just stand in these positions for a certain amount of time, whether it's 5 minutes or 30 minutes. And just doing that is warming up those tissues so that they can shorten and lengthen the way that we are needing to be able to move. From there, the other option, what I like to offer is the vibration platform. Just standing on it makes a huge difference because it's stimulating up to 90% of your body to actually start working, but it's also generating blood flow to the extremity. Today, I'm featuring the Turbo, and on the Turbo, if you go to the set button, which is in the middle, and I always like to choose the higher level programming setting because I like more aggressive. And here's what I want you to remember. As I'm continuing to coach some of you via Zoom, I want to make sure that you all know our products are residential level products, which means they're not going to be at the same level of intensity or the same high dollar technology as medical grade products. So you do not have to worry about, in most cases, you don't have to worry about the machine being too strong that it's going to cause you a lot of problems because it's not likely to happen at this intensity. But there are whole body vibration platform machines that are out there that come at a very, very high level of intensity with a high frequency in hertz. And so what you have to make sure of is if you are using something other than our vibration platforms, that you know that you're using either a residential model or a commercial model, residential medical grade model. The type of vibration is different. A lot of those are linear, which is okay. But if you're wanting to feel things changing and shifting, the oscillation pulsation mode is fantastic. And the turbo units have those. The waiver units have it as well. Well, for the matter, I would say 95% of our platforms that we offer all have pulsation and oscillating movement, which means that it's a teeter-totter sensation and vibration tickling through the surface that you're in contact with. But when it comes to lateral movement, so we have our oscillating, and lateral movement is the machine actually moves, the surface moves side to side. When you create all of those motors going at the same time, you're getting like a spiraling effect. And the more energy that you can introduce using a variety of those motors, the more stimulation you're going to get into the muscle fibers that come in on all different planes of motion. What do I mean by that? I'm going to show you my model here again, and I want to make sure that you know, if we're looking at just the lower leg here, you're going to see that there's muscle fibers that come in on all different angles. Okay, so they're not just side to side, they're not just up and down or on an angle, they're coming in from all different angles. And depending on where our body is requiring to activate, those muscles are coming in from all different angles. So the more motors you can utilize and the more stimulation that you can get from all angles, the better that your body is going to be rejuvenated, ready to go, warmed up, but it's also detoxing and also learning how to fire and couple and work together as one system. So I like, if you're wanting to just get introduced and you don't want anything heavy duty, or if you're on a limited budget and you're wanting to buy a gift for somebody special, the Turbo and the Waiver are both great products, and I usually do not feature those. I'm usually on the Rumble X, which features our three motors. I have those all in front of me. I'll show you a picture or show you what my gym looks like. My gym, which is a lot of Lifepro, I have every Rumble X model in my gym that they make, and we use them in here every single day with 80% of our clients, to making sure that we are giving everybody a warm-up that I use as an assessment tool to being able to working on their bodies to making their pain go away. So on the Turbo, I chose P8 because I want energy. I want to feel as much vibration as possible. And remember, the closer your feet are together, the less energy you feel. The wider that your feet go, the more energy that you feel. And so just standing on here, I'm feeling things above my ankles actually working. And again, it's stimulating so many muscle fibers to work together and breaking apart those adhesions that keep us from being able to move the way we're capable of moving. But just standing on the Turbo, if I just aim to picking up my toes, I'm going to feel that stretch all the way back into my calves and up the Achilles, because the Achilles attaches and transitions into the plantar fascia on the bottom of the foot. And we have a lot of muscles, and we have over 100 ligamentous junctions in the foot. So if our foot is not absorbing energy, or if our foot is tight, it's going to automatically pull on the Achilles tendon or the plantar fascia, because our foot is supposed to be able to absorb up to 1,500 pounds of energy to get our body to move forward, which ultimately also affects balance. So if you are somebody who, whether male or female, who is struggling with balance, the vibration platforms is one of the best things you can do in order to work on balance. Just standing on it is able to teach you how to work on feeling more stable, more balanced. So picking up the toes is a really good thing. You can work on just picking up the heels. Okay, so you can keep your toes down, and you don't have to do a squat. You don't have to do anything forceful, but you can just work on elevating your body so that we are in a position coming onto the balls of our foot where all the power in our body is stored. Now, what I want to make sure that you understand, a lot of people who have had an injury most often will rotate and roll the ankles outward. So I can always tell when I'm working on individuals for the first time if they've had an ankle injury or a foot injury, because when I have them do this exercise, they roll and the ankles bow outward. That is not a good thing. So in that scenario, here's what I want you to remember. On the bottom of the foot, there are 3 prominent points on the bottom of the foot that are really important. And I'm going to pull that up for you here right quick so you can see a good visualization of it. I do a lot of barefoot exercise, a lot of barefoot training, but these points on the bottom of the foot are really, really important. So I like to call the base of the big toe, that's your point A. The base of your little toe is point B, and the base of your heel, center of the heel, is point C. That makes a triplanar foot position, what we call triplanar, so more triangular. But because we are trying to be on a flat plane to being able to absorb as much energy as possible, that is what that would look like. If we're truly looking at the bottom of the foot, that's how it looks like on somebody's skin on the bottom of the foot. So we want to make sure that we're equalizing those 3 points when we're balancing, when we're on the platform, so that you can sense as much as you possibly can, because the bottom of our feet are super rich on neurosensory. Now, and when we're looking at the arch is meant to serve as a bridge. If you have the bridge that's broken and it's not able to withstand energy, then the rest of your body has to work a lot harder. So we want to make sure that we are really working on balancing out the bottom of the foot. And so I like to do that by using a ball in order to force our body to stabilize there. And you can use a variety of different balls, so long as it's a squeezy ball. You don't want a firm object, you want a squeezy ball. But for right now, what I want you to do on your platform, if you have one, is just stand and just feel those 3 points on the bottom of the foot and just make sense. Like, do I feel more on my big toe? Do I feel more on my heel? Where do I feel the energy? Because part of prevention and reducing the risk of injury is being aware of what you actually feel and not being out of control with having to react all the time. We want to really be mindful in our brain as to what we're feeling, as opposed to just doing whatever it takes to make things happen. So as I'm developing that sensory, if we were to lean forward as far as we can without falling off, and so it will look like, I'll turn this to the side so you can see what it looks like. So we keep all those points on the surface. So we don't want to lift our heel yet. We want to stay perfectly flat. But in order to do this, I want you to squeeze your butt cheeks together really tight. So imagine that you're pinching a dollar bill in your booty, and our head and our chest is high, so we're not leaning forward here. But if we're just balancing and we're leaning forward just a little bit, you're going to feel this pulling on the back of your leg. And when we can enjoy the vibration at the same time, it's really, really good for a warm-up. So if you don't want to actually go out and run or ride a bike before you actually have to do something, you can just do this right here before you leave your house to go enjoy your day. So we're leaning as far forward as we can without falling off. If you think you're going to fall off, for balance, just make sure you have something in front of yourself to hold on to. And then from here, like I said, we lifted up the toes before. So from here, let's just ever so slightly lift up our heels. So I'm just barely picking up my heels up off the ground. And again, if you have trouble with this, just bring your feet a little bit closer together where we are a little more balanced. You can hold on to an object if you need to, but just ever so slightly picking up our heels and then coming right back down with control. All right. In doing this, we're actually stimulating all of our muscles in our feet, our intrinsic foot muscles, which only exist in your feet, to work harder than what they're used to working, which means the Achilles tendon and the plantar fascia get to work less. So we're saving that energy for those structures. So we're just elevating those heels up ever so slightly, and then we're coming right back down and relaxing. Okay. Now, if you're struggling with that at home and you're not able to really get that motion in your foot, I'm going to show you using our Lifepro wedges. We've got these wedges that are available. I'm going to show you how you can use these wedges to work on increasing the mobility in your foot ankle. Because some of you, if you've had an injury or if you're just getting older and your structures are becoming more stiff, there are some things that you can do with the wedges that will help increase the mobility within the foot ankle joint. And for those of you, when you do those toe raises, toe raises and heel lifts, when you go onto the balls of your feet, those point A and B, when you go up, if you're rolling out, then you need to do this exercise right here with this ball, okay? And you're not gonna necessarily do it on the platform, you'll do it off the platform. You can turn this to the side, and I'm gonna put the ball in between my ankles. So the ball, whatever kind of squishy ball you have at home, is gonna go right here on the inside of your heel. And we're gonna squeeze that ball with our heels, and we're gonna go up and down. And we're gonna do that for about a set of 20 to 25, if you can tolerate it, okay? And what we are doing here, we are forcing our big toe to actually work. If you have sprained an ankle or you have had an injury to the outside tendons of your ankle, so peroneal tendinositis, if you've got a surgery that you've recovered from, even if it's a bunionectomy, reversing bunions, you can squeeze this ball and then just go up. And if you happen to go out, you actually drop the ball. So it's an easy corrected exercise that you can do that you don't have to wonder if you're doing it right, because if you're doing it wrong, you drop the ball. So you can do it there at the base of the heel. You can also do it in between the calf. So if I squeeze the ball and pop up, it really forces my feet, the bones, and the ankle to really couple and lock in exactly how we're supposed to lock in, which means the energy goes up those joints and through those muscles and through those tendons without working extra harder, okay? So that's how you do that exercise. And again, that's just the basics. Now, if you have the wedges at home, have the wedges, okay? And if you don't feel stable on the vibration platform, but you wanna work some of this, then you're gonna take your wedges and you're gonna put them down on the ground. And what we can start working on is you're just gonna walk onto the wedge just a little bit. So half my foot is on the wedge and half my foot is off. And I'm just gonna lean forward into it, and you're gonna feel a massive stretch on your Achilles. I will bring the camera down here so you can see it a little closer to the ground. Give me 1 second here. And again, if you have any questions, feel free to put it in the comment section below, or something that you might be suffering from, or somebody that you love is suffering from, so that we can try and help you in as many ways as we can, because that's what we're here for. You get the information for free. Okay, so when we're doing this exercise, so here's our wedges. We will put the wedges like such, and guess what? You can actually use the wedges on the platform too, as long as it's not a curved platform. So I'm gonna go about half on, half off. About half on and half off. And all I'm gonna do from here is just lean forward, okay? That automatically lengthens out through here. If I want to feel it more deep inside this instead of on the back side, I'm gonna bend my knees a little bit. So you're gonna feel that not so much back here, but you're gonna feel it much more down here and deep in that tissue. That's your soleus stretch, okay? The other thing that this helps with is it helps with making our big toe more mobile. If your big toe is stuck, then it doesn't transfer energy very well. And if your big toe is not working, then your booty muscle cannot fire. The big toe is responsible for the glute firing up this back chain, super important. And then as you get better and better, you can get into where your foot is fully flat on the wedge, and you can reach down to touch. You might not touch all the way down, but you can work on stretching that. So if you have hamstring tension, if you're one of those people that you're really tied up here all the time, get on your wedge and go from there. Now, I actually have never tried this on the vibration platform. Today is a new day, so let's have some fun. I'm one of those, I like to experiment. I'm like all about trying new things. The challenge I'm gonna run into is these not being big enough. So here's the secret. These will not fit on the Turbo, but they will fit on the Rumble X. So if you have a Rumble X and you're wanting to try and do this on the Rumble X, you can actually do that on the Rumble X. If you want to try something like this on your Turbo, I'm gonna show you a really quick idea that I got in the back of my head. Bear with me for a second while I grab a towel. because you can do this on your wave or on your waver or on your turbo just by grabbing a couple of hand towels. And what you'll end up in doing to get the stretch with the wedge without having the wedge is you'll take your towels and you will roll them up and you'll put it here at the top, okay? And then from there, you'll step on and you're pushing your toes into the towels. I know you're a little crooked here because I got my device here on a platform. There we go. So you might not see my head, but at least you see everything level. So we can put our toes up high, and then we can set our turbo to go off. And from here, now I can work on leaning forward or getting into a squat where I'm really working those lower legs and getting some stretching through here on the tops. So if you don't have the wedges, that's how you can do it with towels, but it's not as good as having the wedges. If you happen to have a Rumblex, since I've not tried this before on a Rumblex, like I said, I love being innovative. I love coming up with new ideas. So I'm going to show you how you can use the Rumblex if you have a Plus or the Relax-A-Vibe or the Max. Just make sure that you don't have one on a curve. You don't want to do this on a curved Rumblex. No curving Rumblexes. Okay. Now, because of all the texture here, I'm going to use the mat on here to position my wedges. And you can do this in a seated position or you can do it in a standing position. So we can get this to work, but I would highly recommend that you do this in manual mode. So you're going to use, there we go. Yeah, so you're going to use this in manual mode because you don't want any surprises. You want to be able to get used to it without any surprises. So I've got manual mode with the oscillation pulsation on, but no lateral because I'm on an unstable surface with the wedges, all right? And so if we looked at from the sideways angle, look that sideways. And again, you can do this from a seated position. If you don't feel stable being standing, you can do this from standing with the wedge, okay? Again, you can do it with a towel as well, but this is how we can work on loosey-goosey up the heels and the Achilles and the plantar fascia without having to feel pain when we do it. All right, so experiment conquered with the Rumblex. So I'm gonna go back to the turbo because I like to demonstrate on the turbo, but I don't do it enough. And again, if you have any questions, put that information out there. And in the meantime, I'm going to show you something else that you can do at the same time with your vibration platform is we can be sitting on the platform and you can pick any massage gun you want. I've got one of our mini massage guns here that I'm going to use. This is the Dynaflex. I'm not sure off the top of my head if we still have this one available to purchase on our website, but you might be able to find it on our Amazon site. What's nice about the Dynaflex, really a lot of our massage guns come with all these different attachment tools. I like to use ones that have a little bit of a soft, springy sensation. So like this one right here is a very hard plastic. I don't like to use that anywhere where there's a tendon because we're already stressing the tendon. So if we can use something that happens to have a softer texture on the tendon because it absorbs impact, that's what I like to do. So make sure that that's in there nice and good. This one actually pivots up and down, so you can pick a different position as the way it works best for you. And hopefully, I have this one charged because I use massage guns every day. And sure enough, I picked one that the battery's dead. Well, jolly. Sorry about that, my friends. I picked one that was used and not charged. So let's see if I can do it this way real quick. If not, we will see what we can come up with, because I've got lots of massage guns laying around. We use them every single day on every single client. And so I want to make sure. Nope, it does not want to work today because I have overused it and abused it. So it is charging though. It does work. It is just dead. So that is my fault for not checking that ahead of time. But again, the other thing that I do have ready for you is we have our Lumicure energy lights. So these are red light therapy and infrared light. If you are wanting the newest and upgraded version, it looks black. So when you're looking at this, whether it's on Amazon or whether it's on our site, it is black, is the Lumicure Pro. And with the Lumicure Pro, it has blue light, red light, infrared light, pulsing light, which excites certain cells to want to attract that energy and make the change. So if you have aches and pains, especially plantar fascia on the bottom of the foot, so there's your combined red light and blue light. So it makes purple light. We're going back to Roy G. Biv. So we put our safety gear on. And if I want to loosen up my body while I'm working, I can be sitting on my platform while I'm holding this Lumicure torch to the bottom of my foot. So if you've got plantar fasciitis, you can do it this way. You can hold it out further away, okay? If you can't get into that position, check it out. Then we can sit on the platform with our feet out in front of us. So we're getting into the area of the sciatic. If you guys have sciatica, you can actually sit in this position and loosen up your sciatic area and your booty, which takes the pressure off your low back, and be working red light therapy on the bottom of the foot at the same time. If you have an Achilles tendon challenge, which attaches here at the base of the heel, just make direct contact at the base of the heel, and you just hold that there for 5 to 7 minutes or whenever the light turns itself off, because it's quote unquote dummy proof. So it'll turn off when you've done a full session. If you want to work directly up into the Achilles tendon, you'll work up a little bit higher, okay? And we're doing this because we are trying to attract more collagenous fibers and regenerate stem cell production. And red light therapy and infrared light therapy, as well as blue light, has the ability to stimulate our brain to start reproducing something that it should always be producing, but it just doesn't. So we're using natural light wave technology in order to feed our body something great that it can then use to convert and create new fibers so that we can age younger as the number on our life continues to increase up. So that is something that you can do with the Lumicure. And I'm switching through all the different light levels, and you can see there's the pulsing. Why is pulsing important? If our brain is stagnant in recognizing its greatest stimulus being red light, we have to provide a different stimulus to catch its attention. And pulsing or flashing red light and infrared light actually stimulates as a new excitatory opportunity. And so when we create that excitatory, I'm going to call it a stimulus, our brain, it's something different that our brain doesn't normally see. So when it sees it the first time, it's like, whoa, what is that? Okay, let's use that. And then it actually can stimulate more red cell, or more, not red cells, but more stem cells, collagenous cells. It can reduce oxidative stress. It can continue to mature and fix the fibrous connective tissue and the cellular matrix because of something new that it's not used to seeing. So sometimes pulsed or flashing works better than constant continuous. And so there's a lot of different options. Now, infrared light therapy is naked to the human eye, but if you look down with your safety protection on, you can actually see when the red light and the infrared light is on. But again, so like right now, everything, hold up here. Turn it off here. There's so many great features, too many features in some ways. There we go. So now we've got it turned off. So it goes back into the box. It's a nice little storage pouch. This is the Limicure Pro. Oh, it is not off. It was a surprise. It clicked itself on because I laid it down face down. Okay, there we go. So there's the Lumicure Pro. The Lumicure Original is a silver light, and it is just red light and infrared light. And we use this a lot in our practice as well. We loan these out quite a bit. We do a deposit and kind of rent them as a lost and found. So if you are a provider to your practice and you have got clients or patients, we actually loan these out with a security deposit, and they can borrow them for a week so they don't have to buy before they try. And in doing that, we get a lot of great use in that they can work on themselves while they're away from us. But if you're wanting to use this from the convenience of your home instead of going into a physician's office, these work very much so at the same level that those other red light therapy devices do work. And you can have it from the convenience of your home. This one turns itself off automatically after, I believe, 7 minutes. And so when you turn it on, put my safety gear on. We provide you safety gear with all the products. You're going to see red light. There is limited red light. There's your flashing red light. And then we also have our infrared light, which is naked to the human eye. So naked to the human eye. So when I go to use this, let me make sure I got it all on. That's both. There we go. Okay, same thing. You can actually put it right there on the bottom of the foot, and you can hold it there. Oh, there we go. You can hold it there for up to 7 minutes. It'll kick itself off automatically, and then you're good to go. And you can use that if you've got patella tendonitis or you've got knee pain. You can use that on your knees. You can use the BioHeal on your knees. And again, I'm sitting on the Turbo, which is great for sciatica. A lot of people have asked me, what can you do for sciatica? That's one of my favorite spots. While the massage gun is charging, the other little secret that I like to use is if we're trying to loosen up our calves, or if we have restless leg syndrome, we can actually use our vibration platform in a seated position. Let's go all the way up here. You can use it in a seated position for loosening up those calf muscles, which then takes the tension off of the plantar fascia and the Achilles tendon. So, and I can position myself so that I have the majority of the platform underneath of my calves. Works really well. Or I can actually position myself so that I have a lot of my body positioned between calves and hamstrings. So if you have struggles with your hamstrings, you can actually scooch up a little bit higher, and you can get a little bit of your calves and a little bit of your hammies, and you'll have the ability to loosen up all across. If you like to be at the same level as your platform, you can use the Horizon Balance Trainer to sit on, and it will also provide you a neutral position to being able to feel relief in those lower extremity muscles and tendons. We have tendons all over. So there's what that looks like. And then if I'm here in that position, I can actually sit up and reach forward at the same time, do some gas pedals. So this is an easy way to warm up your muscles without being weight bearing in line with gravity. We can draw circles. So if you are somebody who is dealing with plantar fasciitis, Achilles tendonitis, shin splints, knee pain, even low back pain, doing this right here makes a huge difference really quick. So it's just how you position yourself. We can do windshield wipers. And if you can loosen up those calf muscles where those blood-rich fibers are located, then it transfers energy much more efficiently, which takes the pressure off of your hamstrings and your pelvis and your low back. When we have individuals that we see that come in that have really tight calves and they're full of knots and it feels like like you've slipped bubble wrap underneath of their skin, those individuals always come in complaining of back pain or hip pain, and it really starts in their calves. So when those clients come in and we start working on their calves and they're questioning, but it's my back that hurts, I don't even have to touch their back. If I touch their calves, their back pain gets better because the fascial line that connects into the back actually starts on the bottom of the foot. So if we're carrying more tension here, it has to pull from the low back. So back pain is not always something wrong with the back. It can be something going on all the way down at the bottom of your feet. So you have to take care of your feet because that's where the energy enters into the body for most people. I just got to tell you, this feels really good. So work on pointing and flexing. Okay. Working on circles, counterclockwise and clockwise. Working on windshield wipers side to side. Okay. And then again, when we go to a standing position, it is about, you might just maybe hold this position right here. It's going to feel like you're actually working your legs and your back, but you're actually stretching out that lower leg while allowing these muscles to break up, because the vibration actually creates like this gentle earthquake effect for those muscles to break up and loosen up and generate blood flow. So one of my favorite positions on here is if you can get down here into this position and just kind of hover. You're not holding yourself, you're kind of resting your upper body on your lower body and just enjoying this. If you're able to get into this kneeling position, I know you're all laughing right now, like one of these days, right? This is one of my favorite positions to end in, and this really opens up the calves and the bottom of the foot, as well as really making you realize like what's going on in your shins, okay? Now, my Dynaflex is, I think, charged enough now that we can check it out. I'm seeing there's nobody responding on to our comment section here. Okay, I thought we were charged up enough. Turns out we're not. Looks like we have to charge. Oh, there we go. We're on. Okay, so we're good. So on the back there, it shows you that it's on. And it actually has a timer to tell you how much time you're using. And this one's got a lot of levels of intensity, so a lot of options. So you can be sitting on your platform, and here's the calf muscle. I'm going to pull up my pants. You can work through your pants though if you choose to, but you're going to start here at the bottom. Start at the bottom, and I like to say 1 inch per second, just 1 inch per second. And we're going to work up very slowly until we get, oh, yes, my calves are really sore because I have not been taking care of myself. So there's the secret I'm letting out. And I can actually see where my muscles are not transitioning the energy, are actually right here is where I'm carrying some extra adhesion fibers that are not allowing my muscles to fire. Really, really sore. And this feels totally different if your leg is bent versus if your leg is straight. So if you're having troubles with reaching yourself down low, then you can put that horizon up high and have your leg out a little bit higher, and it doesn't strain your back or your hips. So you can even do it from up here. But you can see, even as I'm sitting here, my foot is still vibrating. Even though my leg's not on it, my leg is still vibrating, okay? And so you don't have to have contact indirect with the platform. You just have to be in contact with it somewhere and allow your body to adjust to the intensity. So this is like double whammy. I'm like sitting on vibration for a global effect, and from a local effect, I'm actually using the Dynaflex from a local effect to really break things down. So you can find or feel where you are feeling more stuck or more uncomfortable. In areas that you're more uncomfortable, you might be more stuck. But make sure and remember, it's not how hard you push. If you let the massage gun float, it'll tell you exactly where your body is carrying extra energy that it shouldn't. Okay, so just let it float and don't worry about pushing too hard. If you need a deeper level of intensity, then switch out your tip to something of a deeper, of a harder plastic, a bigger tip, or increase your speed or increase or change your angle. So if this is too painful, then you can go on a different angle. So you can take it from the side and you get a different effect. But we're working the whole lower calf complex, because if my Achilles is shortening, then this side up here is lengthening. If this is shortening, then this by default has to lengthen. And sometimes that's the biggest problem. You didn't even have to load the Achilles. It had to lengthen in order for you to actively fire the other side. So it's not always as it seems necessarily, but nonetheless, we will give you lots of different tips, tricks, and strategies on how to help yourself at home. All right, so there's some easy ways. Now, on the bottom of the foot, you're going to start base of the heel, otherwise known as the calcaneus. And if you can't really get down there, you can bring your foot up a little bit higher, but we're going to work on just getting into the base of the heel. You can keep it in one spot. I like to work in circles because it feels really good on the base of the heel to work in circles. The bottom of the foot is really ticklish in certain zones, but in other zones, it's really painful if you hit a hot spot. So just because you hit a hot spot does not mean there's something wrong. It just means you're carrying a little more tension there than you should be, and your body's letting you know it. So I always ask people, does it tickle or does it hurt? Because some people respond exactly the same if it tickles and if it hurts. You want to make sure that you're not going too hard over any bony prominences. So right here at the base of your toe, big toe, if you pull that big toe back and then hit right on the bone, that's a no-no. You don't want to do that. You want to seek more towards the middle between where that tissue attaches at the base and into the heel. So you want to get right in the middle, not on it. Okay? And it works like a big fan on the bottom. So you can work up and down like a big fan, or you can just hold it and move just a little bit at a time while you're holding it. All different kinds of things you can do. But that is how you can work on the lower leg with massage gun, with the horizon, with the turbo, and just getting into some different positions to warm up. So warming up, cooling down, staying active. The longer you stay in a seated position, the shorter those muscles get. So make sure that you're not staying in a seated position for too long, because we're limiting blood flow, we're limiting muscle activity, we're limiting the metabolism in our system, and our body really thrives when it's in a vertical plane. So when we're standing up and down is when it really thrives. That's when things start to happen, because gravity actually provides resistance, and our body has to have resistance in order for it to continue to thrive. So I hope that helps you when it comes to some risk factors. The other areas in which you can work on improving the Achilles and plantar fascia prevention, low back pain, is making sure that you are avoiding or limiting exercises on a very unstable surface, because your body's constantly having to adapt and adjust. The vibration platforms and the horizon are excellent for being able to teach your body how to handle uneven surfaces and how to become balanced and coordinated on uneven surfaces. So if you happen to be a runner, you're doing hiking, you're doing trail walking, I encourage you continue to do that, but make sure if you struggle with balance that you're not stopping what you're doing and you're giving yourself the chance to enrich yourself and improve by providing the proper stimulus. And the Lifepro vibration platforms, as well as doing some unstable training on the horizon, are really great ideas in how you can do that from the convenience of home. So we'll pull that away from there. There we go. And so when it comes to working with the horizon, just standing and doing like a step up. So this is textured and it's unstable. So just stepping up and getting your balance and allowing yourself to be a little wobbly. Don't be afraid of using it. Just make sure that you are standing around something where you feel like you have some control. so that if you do feel unstable, then you can get control of your balance. If you're wanting to work more in single leg, because all sports, majority of sports happen on one foot at a time, you can work on making contact from the back with your big toe or the ball of your foot and just picking the foot up and maintaining balance. So that's just an easy way that you can work those unstable areas, because as my body has to adjust and adapt, we're going to use muscles that we're not used to using all the time. And when those little muscles go to sleep, they don't like to turn back on unless in case of emergency. So this is an easy way to turn on all those muscles again in a controlled environment where you are safe. So that when you are in a non-controlled environment and something unsafe happens, your body already knows how to wake up to that. And then last but not least is making sure that you wear well-fitted shoes that are good with shock absorption, but don't manipulate your feet. So individuals who have orthotics or have shoes that are really controlling, you don't absorb energy the same way. And when you happen to take those shoes off and you happen to go for a walk on the beach, or you go for a walk someplace without those shoes or those insoles in, your muscles are completely turned off when you have those types of structures in contact with the bottom of your feet, because the structure, the orthotic, is actually doing the work for you, which takes the pressure away. And so, but if you don't have that in, and the off chance that you go to wearing something else, you're going to have foot or lower leg pain or cramps because those muscles are used to being turned off. So make sure you have well-fitting shoes that are made for your feet. Running shoes are made for 3 different styles of feet: high arch, low arch, or excessive over controlling, especially over pronation. If you have over pronation, a lot of times you'll have a big angle right here on the inside of your big toe. And if you are an over supinator, that means that you tend to run more on the outside edges of your feet. So you can typically learn how your body loads by taking a picture of the back of your feet and looking at the Achilles and how it aligns. You can take a picture of what your foot looks like wet and putting it on a towel or on a piece of concrete, and the outline of your foot often will tell you how it's loading when you're running dynamically. But make sure that you have a shoe that is made for the type of movement that you're doing. So if you are a walker, you want to make sure that you are wearing a walking shoe or a running shoe that supports your feet appropriately. If you are playing basketball, volleyball, or anything that requires lateral cutting, a running shoe is the absolute worst shoe to have in your foot. So for me, I wear cross trainers all the time because I don't run so much anymore because my body does not handle that impact very well. And so my feet, the bottom of my shoe is made for absorbing all different types of energy, so I can go side to side, I can go forward, and there's enough cushioning in here that if I wanted to jog in these for short distance, like a mile, I'm fine. But if I'm wanting to play basketball or volleyball, or doing some games with kids or adults for that matter, I have the ability to wear something that's not going to allow me to roll. So just make sure that you've got on good shoes for a given sport. My daughter plays volleyball, so we put her in basketball shoes. And there we go. So all is good. Well, we've been on here for quite a while, so I hope that you've learned something new today when it comes to common injuries in men and how to overcome the pain associated with those injuries. Again, huge prevalence in men for ages 20 to 39 in Achilles tendon ruptures. Plantar fasciitis we see in everybody, all ages, all the way down to kids, like age 10. They call it Sever's disease in kids. In adults, it's plantar fasciitis. We've got other videos on YouTube that will coach you on how to overcome foot pain using our many devices, as well as the corrective exercises that you would learn in a physical therapy setting. We provide those on our foot pain videos on YouTube, and so that you can do those exercises at home to save you a little money. But if there's anything that we can help you with, don't hesitate to reach out to us. And for the fathers that are there that are watching or are in your special lives, or the individuals in your lives that make every day count, happy Father's Day to all of you. And on behalf of Lifepro, we are grateful for your support and your interest, and we love being able to serve a purpose to helping all of you with our products. So I hope you have a great day, and I look forward to seeing you next time.